Now, a lot of changes basically takes place whenever the submersion phenomena sets in. Even at a chemical level, at a biochemical level, and the histological changes are even seen whenever the submersion deaths take place. We have to investigate a lot of basically sodium, the chloride levels, even the potassium levels are investigated in such cases. And nowadays, a lot of researchers have been shown for the strontium levels, even that has its own changes, and basically they are marked high up in deaths due to the submersion phenomena. So all of these markers come into play whenever we are going to suspect any antemortem or any postmortem deaths. Again, basically all these chemical tests and these histological tests are basically just are a confirmation for the antemortem or the postmortem drowning. And again, they are going to basically mark a line between the salt water and the freshwater drowning. So all of these basically phenomena come into play. Then we have the chemical changes first of all, and secondly we are going to consider the histological changes. Even at a tissue level, a lot of tissue markers are used for this. The lung tissues are the highlights for these, and what are the changes at the alveolar level that take place. They are very important whenever we are discussing these histological changes. Again, the diagnosis and the diatom test. Now the diatom test is very conclusive, and it basically marks whether it is an antemortem type of drowning or it is a postmortem type of drowning. This differentiation is very important in all the crime scene investigations, and basically provides a foolproof evidence whenever we have these diatom tests at our hand, and these results are very of high significance over here. The chemical changes in the blood in drowning are very important. What are the chemical changes we are going to look for? There is basically a Gettler's test, and with basically the normal chloride content calculation is almost 600 milligrams per 100 ml of blood. And this Gettler's test has its own significance. It's almost 25% difference from the normal state. Is quite significant in such cases, and basically signifies that the death occurred due to drowning. The value of this test is quite doubtful, so there are also false positive results in these Gettler's test, and so we cannot totally rely on this test and its results. Again, we have the freshwater drowning at one hand. Basically, what happens is the blood gets diluted by as much as 72% in 3 minutes, and the blood in the left side is basically the chloride levels are 50% lower than usual on the left side of the heart. So these freshwater drowning phenomena can be discussed in such a way. On the other hand, if we have the seawater drowning, what happens here is the chloride concentration increases due to the hemoconcentration. So all of these phenomena basically come into play whenever we are going to differentiate between the freshwater drowning and the seawater drowning, and the Gettler's test is the mainstay for them. The histological changes in drowning are also very important. First of all, there is emphysema aquosum, that is basically the hyperinflation of lungs is regarded as the emphysema aquosum. The dilatation and rupture of the terminal air spaces are again very important, and they are going to be marked at the autopsy report. If we find such findings for the chemical pathologist, and the chemical pathologist marks these findings, then we are going to write them down in the autopsy report. The dilatation of the alveoli, the thinning of the walls, and the compression of the capillaries is again very important. The number of macrophages in the alveoli are also counted down, and they're noted down and adjusted to the size of the alveoli where the distension took place. So all of these things basically are going to be noted down whenever we have the alveoli at our hand. This is basically a normal, this diagram is basically a normal representation for the hyaline structures. It's basically showing the respiratory epithelium, the serous glands, and the hyaline cartilages. Now, the reduction of the spleen weight and spleen-liver ratios, they're again very important. And the skin changes in maceration. Maceration, as I've already defined, it's basically the thick, white, leathery appearance at the foot and the palms and the soles. So this maceration process is again very important, and it signifies whether the death was due to antemortem drowning or due to the postmortem drowning. The early formation of the adipocere can be detected microscopically at this level, and the histological tissues and their sections are very important in this regard. After 3 to 4 weeks of this, histological changes in the drowning have taken place. Now, the dye atoms and the diagnosis of drowning. It is a very conclusive type of test that can take place over here. The microscopic unicellular LG are again very important in such cases. Siliceous skeleton is basically the highlight for these dye atoms. They are basically a type of plants, and they have basically the frustules are over there, and they are very resistant to decomposition even after death. And if they are found in the skin, they are basically a direct conclusion towards that the death and the submersion has taken place. And basically, even to some extent, they can differentiate between ante-mortem drowning and post-mortem drowning. How? That we're going to discuss right now. They resist the heat and the acid due to this frustule and these siliceous skeleton-like phenomena. The active circulation brings diatoms into intestine, liver, brain, bone marrow. And all of these, basically the presence of these diatoms at intestine, liver, brain and bone marrow, it is very important. If basically the person was drowned post-mortemly, then basically the diatoms cannot be found at this level, because they are only going to be found at the level of the lungs in such a case. But if there was an active inhalational process and the person was drowning, and basically drowning was the cause of death, so in such people, the diatoms may be found at the level of the intestines, the bone marrows and the liver, and these histological specimens are very important and very conclusive that that ante-mortem drowning has taken place in such a case. Now, again, what is the technique behind it? It's very important. Basically, the nitric acid or the enzymatic digestion is the mainstay for it. And basically, there is a centrifuge and the blood is put into it or the tissue is put into it. And this technique is basically going to highlight whether the deposits of these diatoms are present in the blood at the blood level or not. The microscopy is again the mainstay. We're going to have the tissues, and the tissues are basically can be of the liver, they can be of the spleen, of the bone marrows. And if we find these diatoms at this liver and the bone marrow level, it means that the ante-mortem drowning has taken place. This technique is quite it's quite comprehensive and is going to be focused on the presence of diatoms at the tissue level. Now, the principle of diatom test for drowning. This is a very nice diagram showing the whole principle. What happens is if there is a live entry of the diatoms containing water, the diatoms first of all enter the lungs, and then they're going to penetrate the alveolar membranes and enter the main bloodstream. After that, they're going to be entering the heart. And when the heart beats, basically the diatoms basically enter the brain, the kidney, and even the bone marrow at this level. After the acid digestion of the diatoms, they can be recoverable on the microscopy. So this is basically the whole principle. If there is not an active inhalational process or active heart is not beating, the diatoms can never reach this bone marrow and the level of the kidneys. So this is basically the mainstay for that. When death in water is not due to drowning, diatoms may reach lungs by the passive percolation process. But the absence of a beating heart prevents the circulation of the diatoms to the distant organs like the lungs and like the liver and the bone marrow. They can be present in the lungs but not in the bone marrow. Now, what are the disadvantages to this test are? There are some sort of limitations to it. And what are they? Basically, they may be taken from the atmosphere, the diatoms, and there is no reason why they cannot penetrate the intestinal lining. And certain foods, notably shellfish, also contains large amount of these diatoms, and so they can even contribute towards this misleading of the investigation. So these are the limitations for these diatom test. So in this section, basically we dealt with the chemical and the histological changes that take place after drowning, and how are they going to be of benefit for the evaluation of any investigation. That is the end to this section. Thank you for watching sqadia.com.